Most people never imagine that their feet could reveal something dangerous happening deep inside the body. When people think about diabetes, they usually imagine blood tests, sugar, diet, weight gain, maybe fatigue, but very few expect the earliest warning signs to quietly appear in the feet. A strange tingling late at night, a burning sensation after taking off shoes, swelling that slowly becomes more noticeable month after month, or a small cut that suddenly takes far too long to heal. And what makes these warning signs especially dangerous is how normal they can feel at first. Most people blame age, or poor circulation, or standing too long. Some assume it's simply part of getting older, and because the symptoms arrive gradually, they become easy to live with, easy to explain away, easy to postpone, until one day, the body is no longer whispering quietly, it's demanding attention. One of the most dangerous warning signs often begins late at night, when the room becomes still and there are no distractions left, and unfortunately, many people ignore it for years before realizing what their body was trying to tell them. I'm Dr. Adrian Cole, and over the years I've worked with many older adults who are experiencing unusual changes in their feet, without understanding their blood sugar could be connected. In this video, I'll walk you through 9 warning signs in the feet that doctors often pay close attention to when diabetes or rising blood sugar may be involved. And I'll explain them in a calm, simple, easy-to-understand way, not to frighten you, but to help you recognize these signs early, while there is still time to protect your health, mobility, and independence. Because for many people, diabetes develops quietly. The body often whispers long before it screams. One of my patients, Robert Mitchell, was 68 years old when he first noticed something unusual. Robert was a retired electrician from Ohio, the kind of man who spent most of his life solving problems himself before asking anyone else for help. He enjoyed gardening in the afternoons, watching baseball on weekends, and taking slow evening walks with his wife after dinner whenever the weather allowed. To most people around him, Robert looked healthy, active, independent, strong for his age. But slowly, little things started changing in ways he didn't fully understand. At first, it was only a strange tingling in his toes late at night. Nothing severe, nothing dramatic, just unusual enough to notice. Sometimes it felt like tiny pins pressing into the skin. Other nights, it felt like his socks were folded underneath his feet, even when he wasn't wearing socks at all. Robert blamed his old work boots. Then he blamed the cold weather, then aging. But the sensation kept returning. And over time, it quietly became part of his normal routine. That's often how diabetic nerve symptoms begin. Quietly, gradually, almost politely. The first warning sign doctors often notice is tingling or numbness in the feet. Some people describe it as pins and needles. Others say it feels like electrical buzzing inside the toes. And some notice something much harder to explain, a feeling that their feet simply don't feel fully connected to the ground anymore. This happens because elevated blood sugar can slowly damage the small nerves responsible for sensation. Those nerves constantly carry information between the feet and the brain: pressure, temperature, pain, balance. Every step you take depends on those signals working properly. I often explain it to patients this way. Think of your nerves like electrical wiring inside a home. Every wire has a protective coating around it. When blood sugar remains elevated for long periods, that protective layer slowly becomes damaged. At first, the signals still travel, but not clearly. The messages become distorted, weak in some places, overactive in others, and eventually, the brain stops receiving normal information from the feet altogether. Robert admitted something many patients quietly experience. The numbness frightened him more emotionally than physically, because deep down, he sensed something inside his body was beginning to change. And what makes numbness dangerous is not only the discomfort, it's what people stop noticing. A blister from tight shoes, a cut from stepping on something sharp, a pressure sore forming slowly over time, without normal sensation. Injuries can quietly worsen without triggering enough pain to demand attention. And unfortunately, that's where many serious diabetic foot complications begin. One evening, Robert sat in his recliner after dinner, while his wife watched television nearby. He removed his shoes slowly, rubbed the bottom of his foot for a moment, then paused. He realized he could no longer tell exactly where the discomfort was coming from anymore. The sensation felt strangely distant, disconnected. That moment stayed with him, because for the first time, the symptoms no longer felt temporary. But numbness is only one of the warning signs doctors worry about. For many people, the next symptom becomes impossible to ignore once nighttime arrives. The second warning sign is burning feet at night, and this symptom can become emotionally exhausting very quickly. Many patients tell me they feel relatively normal during the day, but the moment they lie down at night, the burning sensation begins building. The room becomes quiet, distractions disappear, and suddenly, the discomfort feels impossible to escape. Some describe it as heat trapped beneath the skin. Others compare it to walking barefoot across hot pavement. Robert started sleeping with his feet outside the blanket because the burning became so uncomfortable. His wife thought the bedroom felt cold, but Robert felt heat radiating through his feet almost every night. Eventually, he began dreading bedtime itself. And many people don't talk about this emotional side of chronic symptoms. The interrupted sleep, the frustration, the quiet anxiety that builds night after night. Because when symptoms return every evening, people stop feeling fully at rest, even inside their own homes. This happens because damaged nerves can begin sending false pain signals to the brain. Imagine a smoke detector with faulty wiring. There's no actual fire, but the alarm continues sounding because the system itself has become damaged. That's very similar to what damaged nerves can do. And unfortunately, many people dismiss these symptoms for years because the discomfort comes and goes unpredictably. But diabetic nerve damage rarely improves by ignoring it. In fact, symptoms often become more severe over time if blood sugar remains uncontrolled. The third warning sign is slow healing cuts or wounds, and this is one doctors take extremely seriously. Healthy circulation is essential for healing. Blood carries oxygen, nutrients, immune cells, everything the body needs to repair damaged tissue. But elevated blood sugar slowly damages blood vessels throughout the body, especially the tiny vessels inside the feet and lower legs. That means wounds may receive less oxygen and fewer healing nutrients, and suddenly, even small injuries can become dangerous. Robert noticed this after trimming his toenail one afternoon. A tiny cut near the edge of the nail remained red and irritated for nearly 3 weeks. That had never happened before. At first he ignored it, then he became irritated by it. Then quietly, he became worried, because deep down, he knew his body wasn't responding normally anymore. One morning, while getting dressed, Robert caught himself staring at the small wound longer than usual. Not because it looked severe, but because it refused to disappear. And sometimes, the body frightens people most when it stops doing ordinary things properly. This is one reason doctors encourage older adults to inspect their feet regularly, especially people with diabetes or prediabetes, because early treatment often prevents much larger complications later. And many people are shocked to discover how quickly a small untreated wound can worsen once circulation and nerve function become impaired. The fourth warning sign is dry, cracked skin around the heels and feet. Now, dry skin alone is common, especially during winter months. But when dryness becomes persistent, deep, or difficult to control, doctors sometimes begin thinking about nerve damage and circulation problems. Many people don't realize that nerves also help regulate moisture and sweating inside the skin. When those nerves become damaged, the feet lose natural hydration. The skin becomes fragile, thin, more vulnerable to cracking. And once the skin barrier breaks, bacteria can enter much more easily. Robert's wife first noticed the cracks around his heels during the summer. At first, they laughed about it and bought stronger lotion from the pharmacy. But over time, the cracking became worse. Some areas began bleeding slightly while walking, and Robert became increasingly uncomfortable wearing sandals around the house. It embarrassed him more than he wanted to admit. And emotional changes like that matter more than many people realize, because symptoms don't only affect the body, they slowly affect confidence too. People stop feeling comfortable, stop feeling normal. Sometimes they quietly stop doing small things they once enjoyed. The fifth warning sign is swelling in the feet or ankles. Now, swelling can happen for many reasons: standing too long, heart conditions, certain medications. But when swelling appears alongside numbness, burning, or skin changes, doctors pay very close attention. Elevated blood sugar affects circulation throughout the body. Blood vessels become less flexible. Inflammation increases. Fluid regulation becomes less efficient. Some people notice their shoes suddenly feel tighter by evening. Others see deep sock marks pressed into the skin after removing them. Robert first noticed swelling after spending most of the afternoon gardening outside, something he had always enjoyed after retirement, the kind of quiet routine that made him feel productive and peaceful. But that evening, removing his boots felt strangely different. His ankles looked visibly swollen, heavy, tight, different than before. And for a brief moment, Robert found himself staring at his own feet longer than normal. Not frightened yet, just unsettled. Because deep down, he sensed his body was beginning to change. That happens more often than people realize. The body adapts gradually, symptoms slowly become familiar, and people stop noticing how much their health has changed over time. But another warning sign disturbed Robert even more than the swelling. The sixth warning sign is discoloration in the feet or lower legs. Healthy circulation gives skin a healthy, natural tone, but circulation problems can dramatically change the appearance of the skin. Some people notice redness, others develop dark patches, bluish tones, or areas that suddenly appear pale and unhealthy. Robert noticed one of his toes remaining dark red for several days. At first, he assumed he had bumped it somewhere, but he couldn't remember any injury, and the discoloration didn't fade. That's because poor circulation limits healthy oxygen-rich blood flow into tissues, and when tissues stop receiving proper oxygen, the skin often reveals the problem visually. I sometimes explain circulation problems like this. Imagine a highway system carrying supplies across a country. Now imagine those highways slowly narrowing over time. Traffic slows down, deliveries become delayed, and eventually, certain areas stop receiving what they need altogether. That's very similar to what poor circulation does inside the body. And because the feet sit at the far end of the body's circulation system, they often reveal problems earlier than many other areas. The seventh warning sign is sharp, stabbing pain. This symptom confuses many people because it often feels unrelated to diabetes. Some assume it's arthritis. Others blame old injuries or aging joints. But damaged nerves can create sudden electrical-like pain signals without any visible injury at all. Patients describe shooting pain, needle-like jolts, sharp stabs deep inside the foot, and many notice these sensations becoming stronger during quiet moments, especially at night. Robert admitted something many patients quietly experience. He became anxious before bedtime, not because he feared sleeping, but because he feared the pain returning once the room became silent again. And chronic symptoms affect far more than physical comfort. They affect sleep, mood, confidence, relationships, even emotional stability. Many people become emotionally exhausted from constantly wondering what their body will feel like tomorrow. The eighth warning sign is reduced balance or loss of sensation while walking. And this becomes especially dangerous for older adults, because balance depends heavily on nerve feedback from the feet. The brain constantly receives tiny signals about pressure, movement, and body position. But when nerve damage interferes with those signals, stability slowly begins declining. Some people stumble more often, others feel unsteady in darkness, and many simply describe feeling disconnected from the floor beneath them. Robert noticed this one evening while walking downstairs. His hand grabbed the railing suddenly, not because he slipped, but because his feet suddenly didn't feel reliable anymore. That moment frightened him deeply, because for the first time, he imagined what could happen if his balance became worse. Falls, injuries, loss of independence. And for many older adults, that fear becomes emotionally overwhelming. Especially for people who spent their entire lives taking care of themselves and others. The ninth warning sign is changes in foot shape or pressure patterns. When nerves and muscles stop functioning together properly, the structure of the foot itself can gradually change. Toes may begin curling, pressure shifts unevenly while walking, and certain areas begin carrying far more weight than they should. Over time, this can increase the risk of ulcers, deformities, and serious walking problems. By the time Robert finally came into the office, several of these warning signs were happening together, and like many patients, he felt ashamed for waiting so long before asking questions. But I told him something I want every viewer to hear clearly today. Most people ignore these symptoms because they genuinely do not recognize them as warning signs. They blame aging, stress, shoes, long work hours, or simply getting older. And sometimes, people are afraid of what they might discover if they finally ask a doctor about it. But catching blood sugar problems early can completely change the future. Robert eventually began checking his blood sugar regularly. He improved his diet slowly, started walking consistently again, reduced processed sugar, drank more water, improved sleep habits, and worked closely with his doctor on long-term management. The goal was never perfection. The goal was stability, protection, control. And over time, some of his symptoms slowly improved. The nighttime burning became less severe. The swelling decreased. His balance improved. And perhaps most importantly, he no longer felt confused by what his body was trying to tell him. That emotional relief matters more than many people realize. Because unexplained symptoms create silent anxiety that follows people everywhere. Now, it's important to say clearly that not every foot symptom means diabetes. There are many possible causes for numbness, swelling, pain, and circulation changes. But when several warning signs appear together, especially alongside fatigue, increased thirst, blurry vision, or frequent urination, doctors usually recommend checking blood sugar levels sooner rather than later. Your body often sends warnings quietly before serious complications develop. The challenge is that those warnings are easy to dismiss, easy to rationalize, easy to postpone, until the damage becomes much harder to reverse. That's why awareness matters, especially after the age of 50. If there's one thing I hope you remember from today's video, it's this. Your feet are not separate from your overall health. They are deeply connected to circulation, nerve function, inflammation, blood sugar, and long-term independence. Sometimes, they become the very first place the body whispers that something is wrong. And those whispers deserve attention. Not panic, not fear, just attention. Tonight, before going to bed, take 30 seconds to look carefully at your feet. Notice the skin, notice sensation, notice swelling. Notice changes you may have ignored for years. Your body may already be trying to get your attention, and listening early could change everything. I'm Dr. Adrian Cole. Take care of yourself, and I'll see you in the next video.